The spine to us is the most important skeleton in the human body just because it's the seat of the central nervous system, right? Because it houses the spinal cord and then the spinal nerves emanate from it as well, right? And then the spine is divided into three segments. We have the cervical spine, thoracic spine, and the lumbar spine. The cervical spine is made up of seven vertebrae. That's those bony cubes, those bony structures you see. I'll show you that picture very soon, or the one it's in the mannequin. So we have like seven of those bony structures that we call the vertebra that makes up the cervical spine. And then we have 12 of those bony structures that make the thoracic spine. Finally, the lumbar spine has five of those bony structures. So each of them are stacked upon themselves, right from the cervical spine down to the lower back area. That's the lumbar spine area. They're separated by this intervertebral disc. We call them intervertebral discs because they are between two vertebrae, right? So these discs, they're just positioned in between them. They act as cushioning material, around the marginal surfaces of the joint. That's the spine, the joint in the spine. And then it also nourishes the joint space, and it enables this range of motion, that you're able to move your body all around because of those intervertebral discs, right? Great. So it's normal. There's this unique shape that it has. The full spine, somewhat like an S-shaped curve like that. So you have this concavity in the back side. Looking at the lateral view of the lump of the spine itself, there's this unique concavity in the cervical spine region at the back side. As the posterior region, it's concave, and the anterior part of the cervical spine is convex, right? And then also the same thing goes with the lumbar spine area. There's this unique concavity in the waist. That indentation you have in your waist, that your waistline that dips inside here. So there's this concave structure posteriorly at the back, and then this convex shape of the spine in the front, like looking at the side view, the lateral view of the full spine. So this concavity or this convexity, depending on which side, is what we call normal lordosis, right? The spine is not supposed to be looking so straight like that from the lateral view. So those unique structures are there. We call those the normal, either cervical lordosis, if in the cervical spine region, or the normal, lumbar lordosis. For the thoracic spine, it's curved in the opposite directions, opposite from the direction of the curve of both the cervical and the lumbar spine. So that one, the concavities in the anterior parts of the thoracic spine, looking at the lateral view, and then convexity at the posterior part of the thoracic spine, right? That one is called the normal kyphosis, normal thoracic kyphosis. So this is normal in the way it looks, right? So in life, it could be due to a traumatic incident like a car accident or a fall from a height, or any trauma at all on the spine. It could cause a shift of one of those vertebrae. One of them is shifts, could be shifting forward or backwards, or even on either sides. Immediately this shifting occurs, the body registers it as an injury, like immediately. We call that subluxation. Sub just meaning sub, less than, less, subluxation, less than a dislocation. So the body registers this as an injury immediately. Then it starts a process of trying to join the vertebra above and then the one below, the shifted one. They tend to pull themselves together. It does that by forming sharp spurs, bony spikes at the edges. The marginal surface starts to grow out. Tiny spurs like that, like sharp spikes, right? We call those spikes osteophytes. So they start growing out and growing out. When nothing is done about that situation, it continues to grow. The process of growing out, first of all, it affects the normal lordosis, the curvature that you should have seen in those regions of the spine I talked about, cervical and the lumbar. Sometimes it tends to straighten it out, or they lose it totally, lose the lordosis. And then over time again, the spikes keeps on growing and growing. You know that there are also neighboring nerve roots. There's a part of the spine, the vertebra, that we call the foramina. The nerves emanate from it. The spinal cord is actually inside. It's embedded inside the spine itself. Is protected by those bony structures, but the spinal nerves emanate from the foramina via the nerve roots down to all the different fibers of the body, the muscle fibers, the internal organs. So they are actually close. They have this close proximity with the vertebra. So when this sharp edges starts to grow out, they have possibility of irritating those nearby nerve roots, or even the nerve itself. They could irritate them. They could impinge upon them. They could even strangulate them, kind of, or depending on what's happening in the body. So when that occurs, the patient starts to feel pain. in wherever those nerves are supposed to be supplying. It may start from the roots where it comes from, the nerve roots itself. Then it could spread down. That's what we call radiculopathy. It radiates all to everywhere that nerve was supposed to supply. All the nerves that come out from the cervical spine region, they supply the whole neck and the upper extremities, the hand down to the fingers, shoulder down to the fingers on both sides. The nerves that emanate from the thoracic spine supply the whole back and the chest wall, right? Then the one that emanates from the lumbar spine area supply the whole waist, the buttocks and the lower extremities down to your feet, right? So anywhere that a particular nerve supplies is where the patient feels the pain radiating towards, if that particular nerve is the one that was irritated or impinged, right? So that's what happened. That's the genesis of all the pain, the low back pain, neck pain, and all of those radiating symptoms. Some people feel it as pain, numbness. Some people feel it as tingling sensation. Some people feel as though they are standing upon needles and all of those things. So it's very, but the pain is so excruciating. It's not something that, it's not a pain that you can just live with, you understand? It's so bad that people are so tempted to say, just get it done with now. I just want to do surgery. You understand? But surgery itself is 50-50, right? It's an invasive procedure. When you're talking about surgery, you're invading the spine itself. I know the delicate structures of those spinal nerves, so there are things that could happen. When I say 50-50, they could come up with complications. You could sever a particular nerve and the person will be paralyzed for life. And in the process of those surgeries, you put what we call the foreign rods, or something that we call Harrington rods, to tend to scrunch or hinge upon the vertebra to keep them in place, so to prevent them maybe from touching on nearby nerves. But those things are foreign materials. Over time, the body could actually develop what we call scar tissue. Those scar tissue will further impinge upon the nerves and cause even more pains, you understand, if the surgery was even initially successful, meaning that the patient was off pain initially after the surgery. But some people don't even come out of pain. In fact, after the surgery, the pains can become aggravated, right? So it's 50-50. So some people actually go about taking pain medications, strong pain medications, or even steroid injections. Those things are just symptomatic relief. It doesn't deal with the root cause of the problem, right? So it could also have its own side effects on your internal organs, your kidneys, your livers, and all of those things. So it's not ideal. We try to wean you off those medications or even the need for surgery. So this is it's a kind of it's a specialized treatment modality that has to do manually adjusting your spine to bring it back to the normal morphology, the way it ought to be. As the process, the treatment commences, a message is sent to your central nervous system to stop degenerating, to stop self-destruct. Because actually, when your initial trauma happened many years ago, the body continued the degenerative process. That degenerative process will cause spondylosis, actually. Spondylosis, that whole pathway of degeneration, downward spiral. The body doesn't know how to do anything else. It's trying to get itself out of the trauma or out of the injury, but it does it in the wrong way. It's like a little child that's in the woods and he's lost basically, but he keeps on going thicker into the forest, trying to come out, trying to find his way. But as he goes deeper into the woods or into the forest, he keeps on entrapping himself more and more until somebody shines a light and says, "Hey, my friend, what are you doing? Come here." So that's how the body works. The spine is actually trying to heal itself or try to save itself, but it's not doing it in the proper way. If you're to cut your skin, for example, the process of the skin's surface is trying to come back together. It's actually regenerative for skin tissue. So that process of self-healing that the skin surfaces tend to pull themselves together to close up is regenerative for the skin. But that same pulling together of the spine, for spine tissue, it's degenerative. So the spine is not supposed to fuse together. It's not. You understand? So that's what the body tends to want to do. So it causes more problems. It's degenerative for the body, for the spine, and then that's what we call the spondylosis. If it happens to your lumbar spine, it's called the lumbar spondylosis. If it happens to your cervical spine, it's called the cervical spondylosis. So this treatment is such that as the adjustment commences, a message is sent to your central nervous system to stop degeneration, stop self-destruct. Then of course you need several sessions. As you continue your treatment sessions, a new process now commences, which is regenerative, allowing your own body to heal itself. It's amazing. So we win a lot of people off surgeries or off pain medications and everything. It's the body's own self-healing mechanism that comes to play. So the body is now told to stop what it was doing that was not helping or that was self-destructive, and now start a new process which is actually really regenerative, allowing the body to come back to normal. Of course, You may even have symptomatic relief almost immediately after a couple of sessions and everything. But for structural changes to occur in your spine, it takes like a couple of years, you understand? So, but the great thing is that you're not going on a downward spiral. You're sure that you're not getting worse over time. Instead, you're getting better. It's amazing. It's been scientifically proven. It's amazing. So we have what we call the spinal decompression therapy. It allows your anywhere that was compressed. Sometimes when the issue, the dyspronosis process commences, the pull of the vertebra tend to compress on the disc space. Sometimes you could push the disc content out posteriorly or anterior on either side to form what they call the disc bulging or disc herniation, depending on what's really happening. So the decompression technology enables the spine to be free from that compression, and it suctions the intervertebral disc back in place the way it should be. It's amazing, really. So we have a lot of testimonials, like great results. It's been proven. It's just amazing. So we want to create the awareness. Then also what we call the home therapy, things that you should do. There are proactive health measures that you could actually take that could help you prevent it in the first place, or to help in your healing process. There are what we call postural hygiene measures. There are some people who don't really know how to sit properly, you don't know how to sleep properly, you don't know how to carry heavy loads properly, So all those measures, they are very, very important. You don't sit and slouch forward. Many professionals, unfortunately, they sit and slouch forward, maybe on their desktop or their laptops or their phones. They tend to slouch forward, or maybe educationists, teachers or lecturers, when they are, with their tables and their materials and teaching materials, even the bank, for example. So most times it's due to our professional lifestyles that we kind of create these habits, these postural malhygiene habits, right? Sometimes it could be our recreational lifestyle, sports that we play. Certain sports over the years also cause a shift or a strain on our spine. Swinging sports, for example. So it's always ideal to always get to go for your spinal hygiene check, at least once a month. You understand? So basically, lifestyle, professional lifestyle, recreational lifestyle, general postural malhygiene, right? Because there are some people, they sleep in the wrong kinds of mattresses. The ideal mattress should be orthopedic or genuinely semi-orthopedic, in such a way that when you lie down those beds, your body you don't indent inside, right? So your weight doesn't compress inside. You don't see yourself dipping inside the sofa or the mattress, right? So your weight should be evenly distributed on the mattresses, and then there are positions that you should take. You should sleep, lie on your back face up is ideal for your spine, or you lie on the sides, on either sides. And there's a particular way you position your pillows, and what we call memory pillows. You position them in a unique way, and then we'll give you these pictorials and the visuals actually to show you how to put your pillows in between your knees, and also at your neck region, to give yourself that neutral, give the spine the neutral shape, the neutral form it should be while you're resting. Over 8 hours. It's long over the night, and you're sleeping. If you don't sleep properly, you wake up and then you have what we call this sway back effect on your neck, especially. And you wake up in pains and all of those things. So those are the factors. Those are the aggravating factors. Postural malhygiene and all of those. Apart from the traumatic incidents, just general wear and tear of life. As you're growing older, it's also a degenerative process that happens as you're growing older. The spine loses its natural, richness, you understand? So it comes down to wear and tear over time, as you age, right? So, and even the activities of life and all of those things. Some people now, even right now, it's not so much of an elderly back pain. Now it's not so much of an elderly person condition anymore. Now young people are coming down with low back pain, neck pain, middle-aged people, just because of the lifestyle, right? Now we're more digital age, or more on the gadgets, and then also children that carry heavy backpacks unevenly, one-handed strap, uneven, compared to the other side of the body, and all of those things. So all these factors come to play, and they're very important. So keep on making the educational videos and helping the public to understand postural hygiene measures and alternative measures to take care of this condition, apart from the surgeries or the pain medications. All right. So I hope this video has been helpful in one way or the other. If you have any questions, can contact me on my social media handles, right? So cheers to your health, cheers to your world. God bless you. Bye-bye.